So first, we're starting here with some median and ulnar nerve tensioners. So these two positions are the end goal, with the arm extended all the way out, and then with the wrist turned in and bringing it towards the head with the elbow up. So again, those are the end positions. For someone fairly limited, this may be all they need. Just going into that just until you feel the slight onset of symptoms and then backing off. You would do this both in the ulnar direction and then in the median direction. 15 to 20 times each side. Here are some simple chin retractions. Again, trying to keep the eyes level, trying to retract the chin back, bringing the skull back towards the wall. Again, 10 to 15 repetitions. Now we have a little bit of a retraction with a side bend, again using the wall as a little bit of resistance. About 5 to 10 reps to each side. Here's a front view of that same retraction with the side bend. Now we have a segmental CatCow. So what I'm doing here is I'm arching down through the low back, then the upper back, and then finally bringing the head up. And now going in reverse. Trying to round out through the low back first, then the upper back, and then finally tucking the chin down. Now bringing the head up, arching down through the mid back, and then finally through the low back. 10 to 15 repetitions of each of those. Next we have shoulder blade mobility. So again, bringing the shoulders up to the ears, forward and back. So up to the ears, forward, down towards the hips, back, and again up towards the ears. Almost going in a square. Here's a mid-back opener. So just dragging the arm along the ground, keeping the knees together, knees up towards the chest. So you can either look towards the moving arm or keep the head looking forward. So here you want to keep the low back flat on the floor, and while doing that you want to reach up above the head. So reaching up and away from yourself. Again, about 10 to 15 repetitions. Here, pushing into the object, pushing away from it, trying to dive the head through. Once you're in that position, a couple of head nods up and down, and then returning to the start. And then again, repeating. Again, trying to push the chest through the arms, and then doing 3 or 4 head nods. Similar position here. So now we're just focusing a little bit more on rotation of the upper back. Similar drill here. You're going to sit back towards the heels a little bit, bringing the arm up, and then rotating with the arm. First, perpendicular to the body, then a little bit higher, and lastly, almost overhead. Again, leading with the arm. Here's the same drill from the front. So again, we want to maximize the range of the arm first, and then let the arm lead the rotation. Again, bringing the arm out all the way out first, and then rotating with the arm. So you want to bring the head up a little bit, and then all you're going to do is you're going to bring the elbows back, squeezing the shoulder blades together. Prone swimmers. So bring the arms up with the thumbs up. As you're rotating down, trying to keep the arms as high as possible until you meet with palms up towards your back. And then again, rotating out, finishing with a thumbs up at the top. You should feel this fatiguing through the muscles of the shoulder blade. Again, 10 to 12 reps. So here's a modified downward dog, similar to the previous positions where you're pushing away from the object and trying to dive the head and chest through the arms. Lastly, quadruped bear rocking. So again, keeping the knees off the floor and just rocking back and forth.